So what instructional techniques do you think work best? Well, it all depends on what your learning outcomes are. So remember, you might be trying to change hearts, you might be trying to change minds, skills, behaviors, systems, environments. Depends on what it is that you're trying to do. So for something like if you want to teach your learners how to do substance use screening or how to do counseling for substance use disorders, the most effective interventions are usually multimodal. So you want to compress or limit didactics as much as you can. And I know that's especially hard when there's so much training that's done online these days. You want to fold in opportunities for discussion, and that's where, learning how to master the Zoom breakout rooms or whatever platform that you're using of how to break people into small groups, bring them back, break them back out. Really important to invest some time on how to do that. Doing demonstrations. So an example would be, so one of the courses that I used to teach was group psychotherapy, and it was we had a depression one and we had one for depression and comorbid substance use disorders. We talked about the theory, we talked about the skills, but then we actually created a brand new small group that the learners sat in, and they watched us run the group. They were sort of a junior co-facilitator. So it wasn't just a classroom demonstration. They were a participant, and they were sort of a junior therapist learning how to do that as we went along. You can include videos, and again, this could be videos that you've created or ones that you've found online. There's, as you know, millions of videos that are out there. The challenge there is sort of weeding through and finding something that's useful for your purposes. We will have a resource list towards the end of the slide set. And then, of course, you want some hands-on practice if you're able to do that, depending on your setting. So how can you refresh didactics? Now, we've mentioned some of these. Some strategies would be to weave in stories and narratives using characters that are similar to your audience. And just to give you an idea of that, I've done a few online CBT courses, cognitive behavioral therapy courses, where at the beginning we introduce 3 or 4 different characters, so actors who are playing patients that are these sort of pre-written scripts. They meet each of those characters, and they're selected for diversity of background, ages, cultures, different problems that they're addressing. And throughout the next 24 lectures for that course, we bring those individuals back to demonstrate how you would do some of those therapeutic techniques that we talk about. But it's the same story of the same character that the learner can watch transform over a period of time. You want to integrate videos that illustrate a teaching point. Sometimes just sort of changing formats can wake people up a little bit, including a fishbowl role play. So when we teach motivational interviewing, we share the research, we share some stories, but then we do a demonstration in front of the class. Or these days we show a video because everyone's at home on Zoom, but we want to show them first. We want to teach them what it is so they know it, then we want to show it, and then actually have them do it afterwards. So that's the see one, do one, teach one idea. Folding in verbal pop quizzes, just again to get people to start anchoring and thinking of information and where they're starting with their current levels of knowledge and experience. This next one is about stories, 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 and I would guess that all of you have a rich library of stories. Sometimes it's hard to think of just the right story, but I would encourage you to create, and I actually have a couple of Word documents, and when I think of a story or have a particular poignant experience that happens, I go to that file and I actually write in, sort of jot down some notes for that story. So when I'm thinking of talks later, I can go back to that. I called it, it's called Memorable Stories. And I go to my Memorable Stories file and I zip through it and think about which of those stories would be most helpful. So when you're telling stories, you want to evoke as many different sensory details as possible. So what did you see? What did you feel? What did you hear? And the richer and more nuanced a picture you can paint, the more likely you are to draw people in to that experience. Now, learners hopefully can relate to the main character, even if it's a different sex, a different age, a different cultural background, but you want to sort of show the humanity of the self-doubts, of the worries, of the family stressors, of the economic stressors that individual might be going through that your learners could also relate to. And the last one, cliffhangers or chapter stories. And I know some people love these and some people hate them, but when we have had a series of multiple lectures, we'll sometimes give like a teaser or a preview of the next session, or we'll pose a particular problem that we know folks are interested in, and then we end the lecture. And the reason we do that is we want them to come back for the next one or come back for the next one so that, again, they can follow that same narrative thread and feel motivated and engaged to come back. I want to talk a little bit about flipping the classroom, and here I think more about how do you expand the reach of your curriculum. So maybe you just have one session, so you're doing a 1-hour class or a 2-hour session. How can you fit in all that you want people to learn? Flipping the classroom means that you move the sort of basic foundational reading, knowledge, didactics, you move that ahead of the class. So people are expected to come prepared and to learn, which doesn't always happen, but they're supposed to come prepared with the basic foundational knowledge. And then the in-person time that you have with them is the application of knowledge. So it's higher up on Bloom's taxonomy. They have the knowledge already, they know the facts, they can describe it, now they're going to see it and maybe they're going to practice doing it while they're in class. Now a lot of times I get the question, well, people tend not to do their homework or they're too busy or they come unprepared. So you want to set a period of time in the beginning where there can be near-peer teaching. There's almost always some students that do come prepared, so have them work with the students who are less prepared to try to raise everyone up so that they can all meaningfully participate. So what techniques should you use? So ask yourself these questions first. So what are the desired learning goals or outcomes? What levels are your learners? What level of sophistication and experience do they bring? What resources do you have at your disposal and how much time? Now in some settings we've had lots of resources, so we were able to create clinical simulations using actors in a studio that looked like an exam room where you would do sort of a medical exam and a medical interview and a diagnosis. There were video cameras, there were expert observers. That was sort of the Cadillac version of a curriculum. Doesn't happen often, but when you do have those resources, you can really get pretty creative. If not, again, going online, going to those digital libraries, and trying to stretch out as much time as you have, putting things ahead of the class, but also maybe following up with the class after the session has ended to circle back and see, did they complete their homework? Did they complete their essay? Were they able to go out and practice the conversations or do the reflection exercises? And can you still give them feedback even after the session has ended?